Radyo Katipunan FM for more exclusive content. Follow at Radyo Katipunan in our social media accounts on Facebook, Instagram, and on Twitter. We are now on YouTube. Watch all of our live episodes plus exclusive content in our channel at Radyo Katipunan FM. Don't forget to click subscribe and hit the bell to get the latest updates. Mamangha sa lalim at ganda ng ating kultura at diwang makabayan sa mga salita at pahina. Sa tulong ng mga guro at manunulat ng panitikang Pilipino, halina't tuklasin ang yaman ng ating panitikan, ang pamana ng ating lahi. Ito ang Sari-Sari, tuwing Miyerkules, 11:00 ng umaga, dito sa Radyo Katipunan 87.9 FM. Mga tinista at mga kapanalig, ito ang balita ng kabutihan, balita ng katotohanan. Radyo Veritas 846 sa Radyo Katipunan 87.9 FM. Halina't makinig at makilahok sa mga isyu at usapan tungkol sa ating pananampalataya at lipunan. Radyo Totoo, Radyo ng Simbahan, Radyo Veritas sa Radyo Katipunan 87.9 FM.
Ready na ba kayo?
Radyo Katipunan, News, Insights, Inspiration. Radyo Katipunan, down from the hill and down to the world. Radyo Katipunan, the voice of the Blue Eagle.
Calling on all young male professionals. Do you wish to live an extraordinary life? Are you tired of the routine and mundane and long for a dynamic, adventurous, and even dangerous life? Do you wish to make your life count and hope to make an impact long after you're gone? Do you wish to live a life of service to society, to country, and to dear Mother Earth? Then you are the one we are looking for. Consider the Society of Jesus. Join the Church's gallant army and turn your world upside down. Call the Jesuits Vocations Promotions Team 426-6101, local 3406. Once again, 426-6101, local 3406.
Radyo Katipunan 87.9 FM.
Radyo, 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 radyo Katipunan. Radyo Katipunan. Radyo Katipunan. Radyo, radyo, radyo Katipunan. Radyo Katipunan. The voice of the Blue Eagle, kami di mapipigil sa pagbabalitang tumpak at tama. Buhay atin sa loob, sa labas ng eskwela, ating ibibida lahat ng eskwela. Radyo, radyo, radyo Katipunan. Radyo, radyo, radyo Katipunan. Radyo Miguel, radyo Katipunan. Radyo Miguel, radyo Katipunan. Kawal ni Ignacio, Katipunero sugo. Todo sa kayod, tulong at tulong. Ipag the Blue Eagle, galing, hiding at tigil. Blue and white.
Dude, it's Jovi Miroy on Thursday uh, on our Profiles and Society program, RK Asks, where we have COVID updates and where we talk about crucial issues with regard to science and technology and society. So with us this afternoon is our regular expert, Dr. Butch Ong, and a guest expert who might also become regular. We'll see. Justin, why do I hear myself? So, Butch, do you have updates? Say hi to our listeners.
Hi, good afternoon, everybody. Glad to be back here and to give you news. It's actually quite encouraging news. I gave you an update last week, and I just received our newest updates. No, unfortunately, I cannot share my slides with you today, but I'll give you the gist of what we found. No, our findings.
All right. Before you continue, let us welcome our guest muna.
Okay.
Our guest, and we'll introduce him later. Our guest is right there, Renzo Guinto. He's also a medical doctor from St. Luke's Hospital. Renzo, can you say hi to our listeners? Welcome.
Hello, everyone. Hi, Jovi. Hi, Butch. Thank you for having me here.
Yeah, so let us greet Quintin Pastrana, who connected you with us. All right. So, Butch,
Okay.
are we still in good shape?
All right. So, okay, here we go. No, now our number of new cases for this week has been decreasing. No, so we are still on that downtrend. No, we had a bit of a little surge last week when we had, I think it was Tuesday or Wednesday, when we had a 3,000 new case for the day. But now we're back to.
Let me confess, I stopped tracking this. I just wait for your updates.
Our production number, which is the transmissibility number, is still less than 1. It is now at 0.87. No, although it has increased a bit. It was, I think, 0.77 last week, but now it's 0.87. But it's still below 1, which means
why did it increase?
I was just probably the number of testing done. There were more testing.
I hope that is
week.
not just a statistical, but is it a significant increase or?
No. The main point of the R value is really it's value surrounding 1.0. Now, if it's beyond 1, it means there is active transmission in the communities.
Are we targeting a specific R value?
We are targeting an R value of less than 0.5. Less than 0.5. Yeah.
5. All right.
And then in NCR, actually, we still consider NCR as the major epicenter of the pandemic. The number of new cases in NCR has decreased to less than 1,000 new cases per day. No, that's a big jump. No,
Wow.
so we're now less than 1,000 a day. No, the R value
So
for
less
NCR,
than 1,000, but more than 900. Ano ba?
yeah, around.
1,000 can be 1. Less than 1,000 is like, but more than 900.
Yes. So, pero still,
Yeah,
it's
all right,
dip.
okay.
No, bumaba na. No?
Yeah.
In NCR naman, our reproduction number is 0.82. So it's still below 1. No? So magandang balita na that our downtrend is still continuing. And it has continued for the last 3 weeks or 4 weeks. Right?
So a person who's infected is not infecting another person or still infecting one person?
Yeah, according to our epidemiological model, it's not being transmitted actively anymore. No? So All right. Our positivity rate for NCR is now 8%. It's decreased. It was 10 last week. It's now at 8. Our target is 5%. Yun ang target natin, no? So, I'll
That's the
just
positivity rate now that you're talking about.
yeah,
The
yeah.
positivity
So,
rate. And
yeah,
it's
for
already now less 10.
less than
It's
10,
already
no?
at 10, less than 10 now. And yeah, it's still 5%.
Yeah.
Some ways to go, but it seems that we're really in the right direction. Is this by
Yes.
the sheer grace of God or by a kind of intervention from the DOH or from
Well,
the hospitals?
it's a combination really of the testing done, the number of testing done, and the data, the granular data, and the DOH dump data that we follow. No, so I think it's also because everyone is getting used to wearing masks like this one. Everyone is getting used to the social distancing. No, so and washing of hands. No? I
I'm not
hope it
sure about
continues.
that, Butch. The people are getting used to social distancing. I just passed by Mandaluyong yesterday, and by the river, there was this group of people fishing together
Together.
from fishing in the Pasig River. So I
uh,
wonder what they catch there.
yeah, not COVID actually. Baka ibang sakit makuha nila yan from the fish in the Pasig River. Uh,
So do
now,
you
I
have
just
any other updates that you want to
yeah,
share?
yeah. I have some high risk areas which I want to
Yes.
mention. No, Benguet, Davao, Iloilo, Cagayan de Oro, Nueva Ecija, the province of Quezon, Pangasinan, Samar, and Zamboanga.
Why are you mentioning these areas now
We
again?
have
And
a
yet I haven't heard that to be a risk area before.
Oo, nagkakaroon ng maliliit na increases, mga pockets of increases in those areas, no? But it doesn't mean there's an outbreak talaga na malaki ang surge those areas. We're just
I
monitoring
thought
them.
Benguet is different from Sagada, right? Benguet is different from Sagada.
I believe so. Yes, I believe
But
so.
because they said that Sagada was so Benguet is no longer an isolate. It's not isolated from
Yeah,
COVID.
oo. Now, one more update, but it's from the CDC. You know, I've been interviewed so many times the last 2 3 days about what the CDC said in their guidelines that there is a possibility.
Center for Disease Control,
Yes, in Atlanta, no, it's the
CDC,
United
Center for
States.
Disease.
Oo. They
All
said
right.
that there is a possibility that the transmission could be airborne or through aerosol. No, it's still a possibility. There is no evidence. There's no direct evidence yet of this as occurring. No, however, there are small reports of it being transmitted indoors. Indoors. No, so, ang nangyayari kasi kapag tayo nagsistay sa loob ng isang kwarto o isang gusali at tayo ay nagsasalita, sumisigaw, kumakanta, no? Small droplets tend to linger in the air longer. So even if the infected person leaves the room, there is still the risk of getting COVID there because of the small droplets. But again, it's
And
more
the
yeah,
the
a mask.
response to that is still mask, face mask, and alcohol or washing of hands. Or
Yes, no. Ang response dyan is really wearing the proper mask, no. So because the particle size is smaller, cloth masks may not offer as much protection now as before, no, when you're outside, no. So we must wear the proper mask and wear them properly, no. So the surgical mask, a 3-ply surgical mask or something like this, no, the N95 or KN95 should be worn indoors. Pero there's something else, no? When aerosol drops to your surfaces, lalo na yung tables, no? These surfaces become contaminated, no? They linger in the air, they'll float, and then they'll just finally land on something, no? So that makes our disinfection and cleaning of frequently touched surfaces like doorknobs, like tables. It makes it more important, no, to bear in mind ngayon, no? So that's it. No? So yun yung ating mga
yes,
updates from Okta and from the CDC.
Renzo, do you have a reaction to that, or do you have your own update?
No, I'm just looking forward to our conversation.
All right. So let us go to that now. We are really looking towards, so we're no longer on what's this immediate response. We are looking towards recovery, I think, and we are also looking towards a vaccine being developed. But I was in a webinar a few days ago hosted by the Asia Society, and the one of the experts there said that maybe what we should look into would be how to vaccinate the entire country. What would be the kind of infrastructure that we would need to vaccinate the entire country? So together with Butch, let's start a conversation on this because RKS may not have a big listening pool, but I think we have a good listening. There are those who listen to us who have the ears of those who have the power to do something. So what questions should we be asking to be able to vaccinate? Because we cannot just vaccinate a portion of the population, right? Or can we? By the way, let us introduce Renzo. Renzo, would you have the honor of introducing yourself? You're a doctor. Do you practice
Yes, I am.
medicine? Do you practice
Well,
medicine?
well, I practice medicine on a population scale, and that
Oh,
is that is what the
my
field of
gosh.
public health is about,
What
diba?
does that mean? What does that mean? You practice medicine on a population scale.
Right. So we public health practitioners and scholars, we don't anymore sit in the clinic and wait for the patient to arrive. And that is what the field of public health is about. We actually do research and policy, similar to what Butch was referring to. They're doing epidemiological studies. Oh, sorry, that is a big jargon, no? Epidemiology, which means,
Yeah, you need to explain.
distribution, and the magnitude, the frequency of diseases in a particular population. And so that's what
I
public health
see.
is about. And since I left med school,
And that's what you studied. You have a
yeah. So since
you studied from UP PGH, and then you did your intramed, right? That's what it's called. Like you
so
skip college. You're a genius, I suppose.
oh, come
Well, you
on.
look like it. And then you went to Harvard for your doctorate in public health.
Correct. So I until early this year. So I actually just returned shortly before the lockdowns have occurred. I've been in Boston for around 3 years, pursuing my doctorate in public health, working on many different issues. But my doctoral dissertation is about climate change and human health, which has some
All
rings.
right. The pandemic is related to that as well already, right? The climate change and the health. So how are you? What have you been doing in relation to COVID then, in terms of public health?
Right. So
Or
as I
have you
mentioned,
been engaged with?
so
Have you
I'm
been engaged with any project?
Yeah, so I've been advising, a hotel chain, different smaller organizations. Not very much involved in the national scene yet. Obviously, because I just recently arrived. And then I am working now with the St. Luke's College of Medicine, which I just joined, to help
Yes.
establish its global health program, which will be focusing on all these issues confronting public health in the
Is that
Philippines.
is that another is that another field altogether? Global health from
Yes,
public
and as
health.
we also say, global health is public health, and it's public health in a borderless world, as now we are seeing with the issue of COVID, but also with the issue
Yes.
of climate change, with the issue of HIV. Mental health is a global health issue as well. We really need global insights and a systems approach in trying to deal with even our domestic public health issues.
Right. So I think that's well within what we're going to be talking about this afternoon, because the vaccine is a global effort, right? But let's start with the basics. What questions should we be asking if we are going to vaccinate the entire country, yeah, Butch, can we vaccinate only a portion, like the military or the Butch is part of the military. Are you part of the military, Butch,
For the Coast Guard.
of the Coast Guard? So can we just vaccinate one portion of the population, like senators or Joe?
Believe it or not, we have done vaccination on a global on a nationwide scale. Vaccination is done through our expanded program of immunization, wherein everyone is recommended to be vaccinated against measles, against tuberculosis, typhoid, and etc. No? But on a global scale, we also have participated in a vaccination program to eradicate smallpox. So I recall my parents and my lolo and lola that they would go to their doctor and they would register for a smallpox vaccine. And
Kailan
masakit
yun?
daw yun. So we already have had experience with vaccinating the whole population, actually, both in a local scale in our EPI, and with in the international global scale in smallpox. So the questions that automatically will enter our minds is that, is it safe? Has it passed our scrutiny and passed our health standards and regulations? No, and to develop a vaccine, you have to test for its efficacy, its dosage, its safety, and then after it's rolled out, no, there's studies to be done afterwards, no, for its long-term effects. So the first thing is that, is it safe? That's the first question I will ask. Is it safe? If it's, is it effective? How did the studies go? No, and how much is it? That's actually one of the questions we had with Dengvaxia. How much was it? No, so with this new COVID vaccine, which is actually being developed by several companies in several countries, no, the question of the cost, of course, is also important.
All right. So Renzo, can
Yeah, you mentioned already, the different criteria by which these vaccines or candidate vaccines will be assessed or are already being assessed now. 10 already passed the efficacy, no, the safety stage, because they're now in phase 3. Phase 3 means we are studying the vaccine in a much larger group of people, around 1,000 or even more. And then now we're making sure that they're really effective. But the first step is really safety. And that's
well,
what.
Renzo, talk to me like I'm a philosopher, and lo and behold, I'm a philosopher. So
Okay.
there is, you're saying that the vaccine has already, there is now where are we now in the vaccine stage, development of the vaccine? Like,
Right. So
are we
as I was
almost at the
saying a
end
while
point,
ago,
or are we
yeah.
almost at the end point, or we're still just starting?
So 10 are already in phase 3. They're being tested in thousands of people for effectiveness. Around 30 are still in the pre-phase 3 phases. We're checking for safety in smaller groups of population. And then more than 100 are still in preclinical stage. So they're not yet being studied in human beings. So that is those are the different phases of the vaccine. To answer your question,
So when do you think there'll be a vaccine that would have
vaccine.
gone through the third? Yeah.
Well,
The third phase.
WSD just a few days back said that the earliest that we will be able to access the vaccine is second quarter of 2021. That's April to June. You also hear news, international news saying that the first vaccine might be already available by the end of the year. But I guess, and similar to what Butch was saying a while ago, will it be affordable? And also, as we speak now, the big and rich countries are already reserving doses for their own countries.
Yes,
and so we're not first in line. We're not in the first 20 countries.
we're not, no?
And that is why WHO, for instance, came up with a COVID vaccine facility that will ensure a more equitable allocation and distribution of
Is that the
vaccines.
COVAX facility?
That's the COVAX
That's the
facility.
one website. I'm actually looking at that now.
Right,
And
right.
you want, so the first question is safety. What's the second question?
So the first is safety. Before we even talk about efficacy in the larger population, we check first if it's safe, right? And then once we know, we've ascertained that a vaccine can be indeed injected in more human beings, diba? Then that's when we try to find out if they're effective. But also we're looking for adverse events. We're looking for potential, side effects. And then maybe you've heard about, in the news, I think a few weeks ago, when AstraZeneca and Oxford University, which formed a consortium to develop one of the candidate vaccines, they had to pause for a while the study because of one patient, and it's just one patient in a sea of thousands that demonstrated or manifested some symptoms, right? And I can't remember the exact case, but ultimately they ascertained that it's not because of the vaccine, it's because the patient had pre-existing conditions. But that is an
Was
important.
susceptible to that, but they cannot rule it out.
We don't vaccinate people who have that, who have the characteristics of that person.
Yes. So is that still safety, or that's effective? What that would already be ineffectiveness?
That
or
is still a safety question.
Safety
but
question.
They actually found out that safety issue when they already rolled it out to a much bigger population.
Yes.
They are already in phase 3, as I've said a while ago.
Right. So then the next question would be cost, or would that be the next question? Cost?
Yes, I think so. I think for countries like the Philippines, we should already be exploring our options on how.
Yes, exactly. Because even if it's, let's say, the second quarter of next year, as Ambassador Thomas said in that webinar, we should be asking these questions now. Like, and that's why, because I'm not an expert, I can only ask questions. So,
and you can ask good questions.
Can you imagine how expensive it will be? Do we have a kind of a experience, historical peg,
right?
How they cost these things, or will it be more expensive at the beginning?
So usually it's more expensive at the beginning, and that is what we've seen in the previous vaccines. But that is why in the past few months there has been a call among world leaders, advocates, even scientists themselves to declare the COVID vaccine as a people's vaccine. And we don't know yet, what is it in legalese, but to make such declaration will somehow signal that the COVID vaccine should be made accessible to all.
Yes.
Capacity to pay should not be a primary criterion. And as a global community, we have to find ways to ensure that the price of the vaccine will be as low as possible. And, one thing is for the pharma company to set a lower price, but there's so many other ways to reduce the pricing of vaccines. For example, if governments actually invest in not just the discovery, but also the manufacturing of the vaccine, that will, lower the cost borne by citizens, because that's already somehow being prepaid, diba, by governments. But what we know is that governments that are currently investing in COVID, although the Philippines, I just saw in the news na we allocated, I think, around 80 million pesos as our contribution to the vaccine trials, because the Philippines is also a study site. No?
Did we sign on the Russian vaccine, right?
I think it's
we're going to be
several others. Yeah. And there's several other vaccine producers that are now talking to our government so that they can.
Is there anything special about the Philippines that they say, oh, maybe we can test it because that on the Philippines is because we're what? Is there anything that they're looking at when they choose which populations to test which vaccine? Or
I
it's
think
a
they're talking to
philosopher's
all
question.
countries. I think they're talking to all countries. They're not just talking to the Philippines. I think they want to make sure that the vaccine will work in a wider variety of populations, not just for the Chinese, not just for the Americans, but also for the Filipinos. But also because that will mean they will have a captured buyer already once the vaccine has been ascertained to be both safe and effective. So there's also an economic motive here. That's why the pharmaceutical companies are already talking to governments. Can we first conduct the study here, and then afterwards, can we be your main distributor?
Yes.
Once the vaccine has been proven safe and effective.
All right. Aside from the safety and the cost, okay, what other questions should we be asking?
So
Is there, yeah, what could be the third question? Are we asking, for example, who are we going to prioritize in? Is it because of the cost? Of course, it won't be a problem for people like Butch, Joe. I guess, just to make it interesting, would medical professionals get priority, or nurses, or as I've said, the military or people in government? But is there already because they can afford it already, diba? So is there a protocol already on who is going to get vaccinated first, or there's none?
So WHO, with the help of the world's ethicists, who are relatives of philosophers like you, right? They've been already talking about developing an allocation framework. So who should be getting the vaccines first, right? Because we really can't produce 9 billion doses of vaccines for 2021. By the way, that is now the number of people we have on planet Earth, right?
Wow, yeah.
And even WHO admitted that we might be only able to cover the whole global population by 2024. So, it's not that, when the first vaccine goes out of the market, early 2021, all of the world's population will be vaccinated. So there should be some criteria for prioritization, who should get it first. It's very clear the first ones who should get are the elderly and the ones with underlying medical conditions, because the outcomes are more severe for them, in contrast to the broader population, the younger people, for instance. I have high hopes that health professionals, especially the frontliners, so not all health professionals are frontliners, such as myself, we're working in the background, but the frontliners should actually be given priority first as well. But these are global frameworks. It's really up to the countries to also turn the global minimum into some national set of guidelines. And I'm pretty sure that the DOST and the DOH are already trying to come up with an allocation framework for the Philippines. But in addition to who gets it, I think the other question that we should ask is the machinery of government, of the national health system, the local health system, ready for rolling out a nationwide vaccination program for COVID? And while Doc Butch a while ago referred to previous experience of vaccinations for measles or even Dengvaxia, right? We've seen a lot of problems in the way we implement vaccine programs before. How can we make sure that we will not see those problems when the COVID vaccine is out? Although now what you hear is some suggestions that the COVID vaccine should be injected not in health centers but in police stations, right? Unheard of.
Why would police stations be vaccine centers?
I don't know what's in the mind of our leaders, and I don't want to go into the politics of.
Did you hear about that, Butch? That
Yes.
what is
Yes.
there? What's in there? What's going on in their mind?
Well, the first thing I recall that the first people to receive the vaccines are the soldiers and policemen because they're in the front lines. But I also did hear about the vaccines being dispensed in this and given out in stations, the police stations. I think because of the chaos it has created, COVID-19 has created a lot of panic among the public, and perhaps a center where there is law and order enforcement. No, I think that would be the. They thought maybe I'm
But
not
we
sure.
probably need to sanitize the police station first.
Absolutely. But I'd like to share that even the police and the military have nurses and doctors in their roles, no? So they are actually also well equipped to perform these duties when the medical corps is tapped, no? Because they are doctors and they are nurses, no? Except that they practice within the paradigm and the four walls of the military and the police, no? But I don't exactly know why it was suggested. No, I can only
I can my fictive mind is working. It's probably because they want to get it first.
uh, it makes sense that those who will do the injection will get it first because they will be the ones first to be
Yeah.
exposed to the general public. Yeah, it makes sense. So if we are going to roll it out in the barangay health centers, the barangay health workers, the midwives, the doctors, and the barangay should be the ones to receive it first. No? Kasi sila
But
yung ma-expose. Eh.
the scenario I'm seeing, Butch and Renzo, is that I guess if you can afford it, that there will be no problem, no? But
Yeah.
there is also a problem of supply. Is that Renzo? Is
There's a
that what
problem of supply, but
yeah.
also and that is, the unfortunately the nature of the Philippine health system, where the access to healthcare is defined by capacity to pay. And probably the three of us are not very much worried because we can easily go to St. Luke's for our hospital
Yes,
to get.
but as you said, I guess the countries I think there are 10 major countries, or even
uh,
how many? Because there are layers, right? In the COVAX facility, there are several countries involved. 29, 64 higher income economies, and then you have 29 from Team Europe. And then you have 156 economies, and we didn't figure in any of the lists. We are really not in any of the list. Is anyone aware? Is like among the two of you, but between the two of you, why are we not part of this? So there are 64, but even in the third list, 156 economies, we're not part of it.
I don't know.
Huh? But
I don't
we
know.
in the list, we are in the parang waiting list. So I guess mauuna muna yung 64 higher economies.
You know, when the vaccine was rolled out, the Philippines was actually part of the testing center for the vaccine. No, the testing began about 8 years, 6 years before it was rolled out here in this country. It was rolled out in areas where there was, of course, an epidemic or dengue was endemic, and we were one of the first ones to receive Dengbaksha, no? But with regards to COVID-19, no, we are part of one trial, which is from Russia, no, and perhaps we will get it there. No? Well, we'll just have to
So
wait and see how
so
the
Renzo, you want
trials
to
go.
you want to give another information on where we figure in the COVAX facility?
Yeah, so I just checked as well the website of
Yeah.
WHO, and the Philippines is listed,
Yes.
in the list of, again, low and middle income countries that will
Oo,
be
yung nasa
supported.
hulihan, no?
That
The
will be
eligible
supported.
economies.
Yes,
Yeah.
and then the rich countries, you know, they're both. Some of them probably will access the vaccines through this facility. Others will just be funding it. And the reason why I'm saying it because, for example, France and Germany, they committed to support the COVAX. so that the poorer countries can access the vaccine.
Yeah, because
But they
if
will
Africa doesn't, because I think they were worried about Africa, no?
Correct. But they
So
will France and Germany already said they will not purchase their vaccines through COVAX because they will purchase it directly from pharma, which they can do because
Yeah,
they have
exactly.
one of the very rich countries. But number two, they're home to the pharmaceutical industry, France and Germany.
Yeah, already see that they're going to profit from it. So we probably need to tease this out some more, no? Especially when because si Butch does the media rounds. We probably need to explain that, and maybe you can do that also, Renzo, eventually. You know, like what is the COVAX facility? So there is the first facility will be like a subsidy facility. Is that what it is? A kind of.
So it's not just subsidy because we already covered that a while ago. That we're trying to pool resources so that we can bulk purchase for the on behalf of the world, right?
Yes.
For the world.
Yes.
Because if you order more doses, then there's a higher likelihood that you'll get a cheaper price.
Correct.
Very simple economics principle. But then, apart from purchasing it on behalf of the world's poorest nation, the distribution is
and that would also so there will be countries funding the research, and then there will be this facility that would allow other countries to purchase them, no?
Right.
And then those countries, and as Secretary Thomas, Ambassador Thomas was saying, that's where we have to put ourselves in other words, as a country, how we distribute it and how we make sure that everybody, there is a kind of an effective strategy, like in vaccinating people. Is that so? Maybe who would be, because in other words, private citizens will not have a problem, but we need to vaccinate the greatest number of people immediately, right? But we can't do that until 2024, or
no, we shouldn't wait for 2024.
What's the vision? So we should vaccinate as many people as possible by next year.
Yeah, next year.
Again, if the vaccine will be available, two, if there will be adequate supply, and three, if we will actually be more proactive instead of reactive in terms of advocating for lower prices of vaccines, for greater access. But this is the thing, and this is where the global health perspective is so important. I can advise the Philippines to be so aggressive and to try to get as many vaccines as possible, perhaps at the expense of poor African countries, because the supply is constant, right? And we will need to divide the pie. And that is why institutions such as WHO are important, to serve as an umpire, to serve as a convener, that, hey, let's not fight over this limited amount of vaccines. Let's distribute it in an equitable way so that rich or poor will have access to it, and that we prioritize first those in need in our respective countries, which is, the elderly, the ones with underlying conditions, and then third, the frontliners. So those three populations. Once we've covered all of these people globally, then we can have the next round, which is to vaccinate the young people, right? Who again are less.
They cannot go out yet.
Yeah,
because they're least priority.
No, but young people can go out. So once we vaccinated the older people, then there's actually we'll feel more confident to actually relax even more some of the measures.
So even if the youngsters go out, they will not necessarily infect
provided they continue with the masking. So it's not like, the vaccine is out today, tomorrow we'll go back to normal right away, It's a gradual process.
And we need to communicate that to everyone.
Exactly.
The vaccine is not a silver bullet. But also we need to plan for it.
We need to plan for it. Exactly. It's not like tomorrow the vaccine is out in mercury drug and then everyone will rush to mercury.
No nga.
Right? And then
because like when hydrochloric, what's that medicine? Hydrochloric.
Chloroquine.
Yeah. They pulled it out immediately, right? They took it out from the drugstore. So it's possible, Renzo, there'll be hoarding.
Possible.
someone is going to like really regulate the supply of in
That's
quotation
the
marks.
yeah, that's the importance of our FDA and our local regulating agencies, no, to safeguard against hoarding, because we want to give and distribute the vaccines to as many as we can.
So
But of
maybe
course,
we can look at our laws ensuring
yeah,
that doesn't happen, especially for this medicine.
we have already two laws regarding COVID. The first Bayanihan Hilas one, and the second one. No, but perhaps when the third one when the vaccine actually finally comes out, perhaps a third legislation is necessary to activate the auxiliary doctors, or the private citizens, to be informed, and to distribute the
Yeah, because
vaccine.
information, Renzo, since you studied this, science communication is going to be crucial for public health, right?
Oh, definitely. I mean, since day one, and we've seen a huge variety of communication strategies since day one. Some work, a lot did not. And we can have a separate conversation just about science communication, where every scientist have basically used Facebook as their way to communicate, as opposed to proper channels. And for instance,
What is the is there like a kind of model for good science communication or public health communication? What would be that model, Renzo?
yeah.
Uh,
Well, I think a lot of countries, we've seen Singapore. We've been so envious
what do
by.
they do? What do they do? What's
So,
their
so
scenario?
one, they get, they convey very clear messages from health authorities alone. Their minister, their Department of Health or Ministry of Health. But second, their head of state, the Prime Minister himself of Singapore.
Who has health issues, right? Maybe
Well,
that helped.
he doesn't have a health background, but he knows the science, and was
Yeah, but he himself got sick, right?
that I don't know. I don't know, admittedly.
Ling Xie, what the name? Yeah, the Prime Minister of Singapore. He has health issues.
Okay.
He has cancer. So the leader himself, Butch, has to embody this. So that has to be communicated to him.
The we've discussed SAGE several episodes ago. No? Science advice for government in emergencies. No? It is from the UK, and an advisory group. No, it advises governments and on what the issues are and what to do, what the studies are. No, in the case of Singapore, that Renzo indicated a while ago, their leader actually communicated the science of COVID early on in a way that was like it commanded respect and acceptance. No, this kind of communication can only be born if the one supplying the information is credible, if the one supplying the information to government is reliable and unbiased. No, so
And Singapore didn't go on a lockdown, right? Not a very strict lockdown.
I think they did. I think they did go on, and remember they also had a surge, a second wave in Singapore. No, but I think they did a lockdown.
Not very strict, because I have a friend who lived in Singapore.
But
Not as
but it's not a prolonged lockdown, because
Yeah,
they did not only rely on lockdowns. They have a very effective contact tracing system, where they can detect all your contacts within the day. We don't have that until now in the Philippines. They've done it electronically. Plus, they have so many other preventive measures put in place in tandem with the lockdowns.
okay. Then the other question we need to ask is manufacturing. Will we be manufacturing this? Butch and Renzo, will we also be engaged in the or only distribution?
I don't know about our facilities, no? If our facilities can manufacture, if our ITM, for example, or the NIH can manufacture vaccines in the scale that is necessary for the country, we have so many people, no? The most effective, because we cannot wait until a facility is set up and produce experts to make vaccines, no? The best route for early intervention or early distribution of vaccines is to procure them from an already from someone who's already produced and did the testing, no? So for me, the best route is really to procure them
But distribution
those.
would still be done by a pharma company, by a drug company. Or can Mercury Drug just distribute it? No.
Well, that
Through
will depend.
doctors or through health centers, or how do you envision this? Would doctors have to dispense them? I mean, not dispense them, prescribe them, or
That would
that's a
depend.
mandatory vaccination?
That would depend on the policy set by government once vaccines are already available, or once there is word that vaccines will be allocated to us, no? The policies will have to be laid out and clearly communicated to the people, para walang hindi para clear ang lahat, no? So I think it should be in a form of an administrative order or something from Congress, no, para sigurado everybody will follow it, no? So the distribution, the procurement, everything about the vaccine should be clear. For me, the best, really, we've done it twice already with Bayani and Hilas one. We might as well prepare for another congressional.
That's the conversation we want to start.
Yeah,
So I think we're ready. We need to go to start now, because
exactly.
that's not going to be an easy task if precisely up to now we don't have the necessary response mechanisms. Then we don't want to do that. We don't want to do the same thing when it comes to the vaccination, right? Now,
Right.
what is the role of private citizens? Because of course, much of this is on government's hands, but just like anything in this country, private citizens don't take the initiative, government will not follow suit. What is the role of private citizens? And I mean really common people.
Well, I think
Renzo.
it's good, as you've said, it's good that we're talking about this issue now. And I think our government officials, a lot of them are colleagues actually, are already having these
And
kinds
you were
of.
in government before, right? You were in government.
I just for a year, I helped the DOH on
That-
the health of OFWs. Another different topic, but I wanna focus on this one.
yeah.
There are already efforts being done internally. So a while ago, you were asking about, are these vaccines going to be manufactured here? And there's actually a list of 6 pharmaceutical companies from overseas already in talks with Philippine government. And 2 out of the 6 actually want to even build local manufacturing capacity. So they might actually build factories here for their vaccines. But, one is from Russia, another one is from China. And so that's definitely very interesting. But in terms of your question about private citizens, good thing we're having this conversation. I think people should be asking in social media, to their representatives, what is the game plan for vaccine rollout? Our friends from the private sector, health facilities, hospitals, the Mercury drugs of the country should also be asking these questions as
And
well.
then would there be like a generic version? Generic version or branded version, or
So it's not going to happen in the next 20 years because there is an international, treaty
So no generic version.
Surrounding intellectual property. So it will take 20 years unless, and that is why I said a while ago, unless
People's vaccine.
it becomes declared as a people's vaccine. So no single pharmaceutical company can actually file, for a patent, for the vaccine. But again, this has never been explored before. These are new issues. And
because
I think
it probably cost a lot to produce the vaccine, to research the
indeed, that is always the justification of the pharma industry for having that 20-year monopoly over their vaccine product. But again, if governments will step up and they will say, we will invest in COVID vaccine research, which some governments have done in the past several months, then there will be a much stronger argument that these vaccines are not the pharmaceutical company's vaccine, but truly people's vaccine paid by people's taxes.
Right. So the role of citizens would be to start the conversation and ask these questions. So safety, cost, and allocation or distribution, equitable distribution, ethical distribution. So there you go. Philosophers have a role in it. So in terms of what will be the, culturally, because we started with that Dengvaxia. I can only imagine, Renzo, that you were there in DOH.
I was
No. So who's
and at
you were there.
At 4 a.m. Boston time, which is 4 p.m. Manila time, I've been watching the Senate hearings.
But were you in DOH?
No, I wasn't in DOH.
No, so who was the DOH secretary then when you were in DOH? Full disclosure.
Yeah, it was still Secretary Ona. And I was working as a consultant on a project.
All right, okay. But anyway, because will there be like is that because communication, yes, and that's something that still has to be done, how this is going to be communicated. But there is also the cultural aspect. Let's not go like you anti-vaxxers, but because of Dengvaxia, historically, would there be a cultural obstacle? Will people not take to this vaccine, or will they, because Duterte keeps on talking about it?
I think there will. Dengvaxia has created such a stir with regards to vaccination programs. In fact, after the Dengvaxia issue, the number of babies and children that were vaccinated dipped. No, so however, in this case, everyone has an experience with COVID. Almost everyone knows someone else who knows somebody else who has had COVID or has even died of COVID-19. So perhaps we will see much less of an impact with regards to naysayers or negativities around this vaccination, no? Because everyone has felt it. Unlike dengue, when we had the Dengvaxia issue, it's only from a particular group, or from the education sector, because it was rolled out in public school, in the DOH, but this time almost everyone knows somebody in their barangay who has been quarantined. So with the negative impact, I don't think we'll see that much of a negative impact.
And people losing jobs and
That's right. With the way things are going,
OFWs coming home.
yeah, dahil medyo mabagal ang pagbukas ng ating commerce and industry, people really want to go back to work, want to get back to the normal. And if vaccination is the way to do it, I don't think there will be any objections or resistance. That's right.
Well, this Renzo, what do you think? Well, because you came from the country of anti-vaxxers.
Correct. But also, again, because of Dengvaxia, among other issues in the past, not to mention problems in the implementation capacity of the health system, we've seen a gradual decline in vaccination rates.
Vaccination.
Some
Because
danger.
they're even claiming that it causes mental disabilities in children, di ba?
Well, that has already been
Not only dengue vaccine, but that's this thing has been going on, di ba? This
Yeah.
anti-vaccination.
That's an unfortunate dahil there was one publication published in Lancet many decades ago, which was actually retracted. The publication retracted that article. And it gave a special issue to explain what happened. No? Vaccination was linked to some neurologic issue, no? But there was proof already that the data was tampered with, and there was dishonesty in reporting and publishing that article. So actually doon nag-umpisa talaga yung anti-vaccine issues, no? And it's we have to communicate that without the vaccination, for example, in smallpox, which has eradicated millions of people, no, we are alive now because of what happened and what Dr. Jenner, the one who created the vaccination from smallpox, did. No, in fact, many of us are alive because of vaccination. No?
Right.
So it's all
So
about.
Butch, you can on that note, you want to give your final message for this afternoon, and then we'll end with Renzo.
All right. Actually, I'm also looking forward to what is going on and what will happen to the vaccination trials. We are on the third phase already. Many companies are in the third phase, and I'm eager to find out more about the rollout and how we will roll it out. No, we must make good policies. We must have good advice, and we must have good.
Anti-hoarding mechanism.
Yes, yeah, and most importantly, with regards to science, technology, and society, science communication. No, we
Science
must
communication.
communicate the science to the public.
Will
So
will this really be a vaccine, or can it be taken, or what? How is there already word on that?
no, I don't have any word.
Ah,
There are many forms. It can be injected. It can be like polio, patak lang siya. No, there can be many forms. I still don't know how in what final form it will be.
all right, Butch. See you next week. Thanks, Renzo.
Yeah, well,
Uh,
first and foremost, thank you for having me here. It's a fun conversation.
is your name short for Lorenzo? Is that your or
Correct.
that's
Yeah,
your
yeah,
name?
yeah.
All
I
right.
have a long name. Wag na lang. But Renzo should be fine. But yeah, I mean, to just add to what Doc Butch already mentioned, you know, let's start asking the right questions. And this is an initial conversation. We still have a long, way to go when it comes to the vaccine. And let's all do our part to protect each other. It's not just protecting ourselves, but protecting each other, our family members, our loved ones, our communities. And so let's all stay safe, and we will overcome as long as we work together.
Correct. All right. So nice meeting you, Renzo. Hope to be able to talk with you again when we deal with the climate change and health. Huh? All right. So see you and thank you. Thanks for listening to us this afternoon. I hope that we'll be able to start this conversation on how to recover from the COVID-19, especially in relation to equitable and ethical distribution of the vaccine. So till the next time, this is Joe Mirai. See you.